Mannitol. Expanded lecture notes. In the high-stakes world of critical care, precise interventions can be the difference between recovery and crisis. Mannitol stands as a potent tool for managing life-threatening increases in intracranial and intraocular pressure. Let's explore its role, benefits, and considerations in optimizing patient outcomes. Other names. Generic name: Mannitol. Trade names: Osmotic, Resectisol. Drug class: Osmotic diuretic. Other names: D-mannitol, Mannitol. Introduction to Mannitol. 1. Mannitol is a sugar alcohol used as an osmotic diuretic and renal protective agent. Mannitol is a type of compound that acts to increase urine production and has protective effects on the kidneys in certain situations. 2. It is commonly used to reduce intracranial pressure, intraocular pressure, and to promote diuresis in specific clinical situations such as acute renal failure and toxic overdoses. Mannitol helps decrease pressure in the brain or eye and can help remove toxins by increasing urine output in certain cases. Definition of mannitol. Mannitol is a non-metabolizable polyol that increases plasma and tubular osmolality, drawing water from tissues and promoting osmotic diuresis when administered intravenously. This means, mannitol isn't broken down by the body, non-metabolizable. It increases the concentration of particles in blood and kidney tubules, osmolality. This pulls water out of tissues into the bloodstream. The kidneys then remove this excess water, leading to increased urine output, osmotic diuresis. History of mannitol. 1. First isolated from tree sap, Mannitol. Mannitol was originally obtained from the sap of certain trees. 2. Medical use began in the 20th century for reducing brain edema. Doctors started using mannitol in the 1900s to help reduce swelling in the brain. 3. Has since become a standard drug in neurosurgery and emergency medicine. Mannitol is now commonly used in surgeries involving the brain and in emergency situations to manage conditions like increased brain pressure. Classification of mannitol. 1. Pharmacologic class: osmotic diuretic. Mannitol works by increasing the amount of water in urine through osmotic effects. 2. Therapeutic class: diuretic, cerebral decongestant. Mannitol is used to increase urine output and to reduce swelling in the brain. 3. Pregnancy category: C. Use with caution. This means mannitol should be used in pregnancy only if benefits outweigh risks. 4. WHO essential medicine. Mannitol is considered a critical medicine by the World Health Organization for certain conditions. Chemical properties of mannitol. 1. Molecular formula: CHO. This shows mannitol is made of 6 carbon, 14 hydrogen, and 6 oxygen atoms. 2. Molecular weight: 182.17 grams per mole. This is the weight of one molecule of mannitol. 3. Structure: A6 carbon sugar alcohol. Mannitol is related to sugars but acts differently in the body. 4. Solubility: highly water-soluble. Mannitol dissolves easily in water, useful for IV administration. 5. pH solution: 4.5–7.0. Solutions of mannitol for medical use have a pH in this range. Physical properties of mannitol. 1. Form: white crystalline powder or IV solution. Mannitol can be found as a powder or already mixed in a solution for IV use. 2. Appearance: clear or slightly yellow solution when in IV form. Mannitol solutions used in hospitals are typically clear or slightly yellow. 3. Taste: sweet. Mannitol has a sweet taste. 4. Storage: room temperature. Avoid freezing, may crystallize. Mannitol should be stored at normal room temperatures and not frozen to prevent crystallization. Mechanism of action of mannitol. 1. Increases osmotic pressure in plasma. Draws water from intracellular to extracellular space. By increasing the concentration of particles in blood, mannitol pulls water out of cells. 2. In the kidneys, mannitol gains in the renal tubules. Pulls water into the lumen leading to increased urine output. Mannitol isn't reabsorbed in the kidneys, so it keeps water in the tubules, leading to more urine. 3. Reduces intracranial and intraocular pressure by shifting water out of brain and eye tissue into plasma. This effect helps decrease swelling or pressure in the brain or eye. Pharmacokinetics of mannitol. 1. Absorption. Not absorbed orally, must be given IV. Mannitol needs to be given through a vein to work. 2. Onset. IV, 15 to 30 minutes. Effects of mannitol start within 15 to 30 minutes after IV administration. 3. Peak. 1 hour. Mannitol's effects typically peak about an hour after given. 4. Duration. 4 to 6 hours. The effects of mannitol usually last for several hours. 5. Metabolism. Not metabolized. Mannitol isn't broken down by the body. 6. Excretion. 90% excreted unchanged by the kidneys. Most of mannitol is removed from the body through the kidneys in its original form. Pharmacodynamics of mannitol. 1. Reduces intracranial pressure in cerebral edema. Mannitol helps decrease swelling in the brain. 2. Reduces intraocular pressure in glaucoma. Mannitol can help lower pressure in the eye in certain situations. 3. Promotes renal perfusion and diuresis in acute kidney injury. Mannitol increases urine output and can help kidney function in specific cases. 4. Has no direct effect on electrolyte excretion, but can indirectly alter balance through volume changes. Mannitol doesn't directly affect electrolytes but can impact them due to changes in fluid balance in the body. Storage and disposal of mannitol. 1. Store IV solutions at 20 to 25 degrees Celsius, 68 to 77 degrees Fahrenheit. Mannitol IV solutions should be kept at room temperature. 2. Inspect for crystallization. Warm to dissolve if needed. Check for crystals in the solution and gently warm if crystals form. 3. Use filter needle if crystals are present. If crystals are seen, use a filter needle to avoid injecting particles. 4. Discard unused solution per hospital waste protocol. Throw away unused mannitol solution following hospital guidelines for disposing medical waste. Drug interaction. Lithium. Reduced serum lithium levels due to increased excretion. Mannitol can cause more lithium to be removed in urine. 2. Digoxin. Risk of digoxin toxicity if hypokalemia occurs. Mannitol can lead to low potassium levels, increased risk of digoxin side effects. 3. Other diuretics. Additive fluid, electrolyte loss. Using mannitol with other diuretics can increase loss of fluids and electrolytes. 4. Tobramycin, gentamicin. High risk of nephrotoxicity. Using mannitol with these antibiotics may increase risk of kidney damage. Clinical uses of mannitol. 1. Cerebral edema, reduce intracranial pressure. Mannitol helps reduce swelling in the brain. 2. Raised intraocular pressure, acute glaucoma attack. Mannitol can lower pressure in the eye in emergency situations. 3. Prevention of acute renal failure in shock or trauma. Mannitol may help protect kidney function in certain critical cases. 4. Rhabdomyolysis or hemolysis, to flush out myoglobin, hemoglobin. Mannitol helps remove harmful substances from kidneys in these conditions. 5. Toxic ingestion, to promote renal clearance. Mannitol can increase removal of some toxins through the kidneys. Use of mannitol in ICU. 1. Management of brain edema in trauma, stroke, tumor. Mannitol helps reduce brain swelling in these critical conditions. 2. Preservation of renal function in early OCI. Mannitol may help support kidney function in certain cases of acute kidney injury. 3. Used with close monitoring due to risks of electrolyte imbalance and volume overload. Because mannitol affects fluid and electrolyte balance, ICU patients on mannitol need careful monitoring. Use of mannitol in anesthesia. 1. Common in neurosurgery to reduce brain bulk. Mannitol helps decrease brain volume, making surgery easier. 2. Sometimes used in eye surgery to reduce IOP. Mannitol can lower pressure in the eye during certain eye surgery. 3. Monitor CVP and urine output intraoperatively. During surgery with mannitol, doctors watch central venous pressure, CVP, and urine output to manage effects. Use of mannitol in emergencies. 1. Emergency treatment of cerebral herniation signs. Mannitol helps reduce brain swelling in life-threatening situations. 2. Acute angle closure glaucoma. Mannitol can lower eye pressure quickly in this emergency. 3. To induce diuresis in poisoning. Mannitol may help remove toxins via increased urine output. 4. In renal protection during contrast-induced nephropathy. Mannitol has been considered for protecting kidneys in certain cases involving contrast dyes. Administration and dosage of mannitol. 1. Indication: cerebral edema. Adult dose: 0.25–1 gram per kilogram IV over 20 to 30 minutes. Mannitol is given IV to reduce brain swelling. 2. Glaucoma. Adult dose: 1.5–2 gram per kilogram IV over 30 to 60 minutes. Mannitol can be used to lower eye pressure in glaucoma. 3. Diuresis. Adult dose: 50 to 100 g per day IV infusion. Mannitol can be used for promoting urine output. 1. Use inline filter if crystals are present. If mannitol solution has crystals, use a filter to avoid injecting particles. 2. Avoid extravasation, risk of tissue injury. Mannitol IV should be given carefully to avoid leaking into tissues around the vein. Side effects of mannitol. 1. Headache. Some patients may experience headaches after mannitol administration. 2. Nausea, vomiting. Mannitol can cause stomach upset or vomiting in some cases. 3. Chills. Patients might feel chills as a side effect of mannitol. 4. Dizziness. Mannitol can cause dizziness in some people. 5. Polyuria. Mannitol increases urine output, leading to frequent urination. 6. Dry mouth. Some patients may experience dry mouth due to mannitol's effects. Serious side effects of mannitol. 1. Electrolyte imbalances, hyponatremia, hypokalemia. Mannitol can cause shifts in sodium and potassium levels. 2. Pulmonary edema, especially in heart failure. Mannitol can lead to fluid buildup in lungs in patients with heart issues. 3. Dehydration and hypotension. Excessive diuresis from mannitol can cause dehydration and low blood pressure. 4. Acute kidney injury with excessive dosing. Too much mannitol can harm kidney function. 5. Allergic reaction. Some people might have an allergic response to mannitol. Contraindications of mannitol. 1. Anuria, no urine output. Mannitol shouldn't be used if patients aren't producing urine. 2. Severe heart failure or pulmonary congestion. Mannitol can worsen fluid overload in these conditions. 3. Active intracranial bleeding, except during craniotomy. Mannitol is generally avoided in active brain bleeding unless in a surgical setting like craniotomy. 4. Severe dehydration. Mannitol can worsen dehydration. 5. Hypersensitivity. Mannitol shouldn't be used in patients with known hypersensitivity to it. Precautions with mannitol. 1. Monitor. 1. Serum osmolality keep less than 320 mosm per kilogram. Keeping serum osmolality in check helps avoid complications. 2. Renal function. Mannitol's effects on kidneys need monitoring. 3. Electrolytes. Mannitol can cause electrolyte imbalances. 4. Fluid balance. Monitoring fluid status is key with mannitol use. 2. Use cautiously in 1. Elderly patients. Elderly may be more sensitive to mannitol's effects. 2. Cardiac or renal dysfunction. Mannitol needs careful use in patients with heart or kidney issues. Advantages of mannitol. 1. Fast-acting osmotic effect. Mannitol quickly reduces swelling or pressure. 2. Effective in reducing ICP and IOP. Mannitol lowers intracranial and intraocular pressure effectively. 3. Useful in preserving kidney function. Mannitol may help protect kidneys in certain situations. 4. Non-toxic if used correctly. When used properly, mannitol is generally safe. Disadvantages of mannitol. 1. Requires IV use only. Mannitol must be given through a vein. 2. Risk of volume overload or dehydration. Mannitol's effects on fluid balance can go either way. 3. Can cause electrolyte derangement. Mannitol use may lead to imbalances in electrolytes. 4. Short-acting, may require repeated doses. Effects of mannitol don't last long, possibly needing more doses. Clinical considerations. For mannitol. 1. Check. Urine output more than 30 milliliters per hour before giving. Ensuring adequate urine output helps mannitol work effectively. 2. Serum osmolality and electrolytes. Monitoring these helps avoid complications. 3. Stop infusion if signs of fluid overload or pulmonary edema. If these issues develop, mannitol should be stopped. 4. Use caution in CHF and CKD patients. Mannitol needs careful use in patients with heart failure or kidney disease. Comparison with other agents. 1. Mannitol. Agent class. Osmotic. Key use. Down-pointing arrow ICP, intracranial pressure, diuresis. Duration. 4 to 6 hours. Mannitol is an osmotic agent used to reduce brain swelling and promote urine output. 2. Furosemide. Agent class. Loop diuretic. Key use. CHF, congestive heart failure, renal failure. Duration. 6 to 8 hours. Furosemide is a diuretic used mainly for heart failure and kidney issues. 3. Hypertonic saline. Agent class. Osmotic. Key use. Down-pointing arrow ICP with less diuresis. Duration. Variable. Hypertonic saline reduces brain swelling with less impact on urine output compared to mannitol. 4. Acetazolamide. Agent class. Ca carbonic anhydrase inhibitor. Key use. Down-pointing arrow IOP, intraocular pressure, in glaucoma. Duration. 6 to 12 hours. Acetazolamide is used to lower eye pressure in glaucoma. Additional information about mannitol. 1. Crystallization is common in cool environments, warmed gently to dissolve. Mannitol solutions can form crystals in cooler temps, warming helps dissolve them. 2. Not metabolized, excreted unchanged by kidneys. Mannitol isn't broken down in the body and is passed out via urine. 3. Mannitol may cause rebound ICP if overused. Too much mannitol use might lead to increased intracranial pressure later. 4. Use caution in neurosurgery. Avoid overcorrection. In surgeries, careful use of mannitol avoids over-reducing pressure or swelling. Current trends. 1. Hypertonic saline now preferred over mannitol in some ICP protocols. In managing severe traumatic brain injuries, controlling ICP is crucial. Hypertonic saline has emerged as a promising alternative to mannitol due to its efficacy in reducing ICP without compromising cerebral perfusion. Some studies suggest hypertonic saline has a longer duration of effect and shorter ICU stay compared to mannitol. 2. Research into neuroprotective effects. Both mannitol and hypertonic saline are used to reduce ICP osmotic effects. Research is ongoing to understand their comparative effectiveness and potential neuroprotective strategies in traumatic brain injury management. 3. Combined use with loop diuretics in ICU for synergistic effect. While specific studies on combining hypertonic saline or mannitol with loop diuretics for a synergistic effect in ICU settings are limited in the search results, the general approach in managing ICP involves optimizing therapeutic strategies for individual patient needs. Research. 1. Trials on mannitol in stroke and traumatic brain injury. Mannitol is used to reduce intracranial pressure in acute brain diseases associated with cerebral edema. In a study on patients with non-traumatic intracerebral hemorrhage and acute kidney injury, mannitol use was associated with higher 28-day all-cause mortality. However, this finding should be interpreted with caution due to methodological limitations. 2. Studied in kidney transplant perfusion. While there's limited direct information on mannitol in kidney transplant perfusion in the search result, mannitol's role in nephron-sparing surgery was studied. In a randomized trial on patients undergoing laparoscopic nephron-sparing surgery, mannitol administration was found to be equivalent to placebo for renal functional outcomes. 3. Role in reduction of contrast nephropathy under evaluation. There's no direct information in the search results regarding mannitol's role in reducing contrast nephropathy. However, mannitol's effects on renal function in various surgical contexts were studied. For example, in patients undergoing cardiopulmonary bypass, the relationship between mannitol and renal failure was discussed in terms of biomarkers. Conclusion. About mannitol. 1. Mannitol is an essential drug in critical care and neurosurgery. Mannitol plays a key role in managing conditions like cerebral edema in these settings. 2. It provides rapid osmotic diuresis, helps lower intracranial, intraocular pressure, and protects the kidneys. Mannitol's osmotic effects help reduce swelling in the brain or eye and promote urine output. 3. However, it must be used judiciously, with close monitoring to prevent complications like electrolyte imbalance and volume overload. Careful use of mannitol is needed to avoid potential issues like electrolyte problems or fluid balance issues. Professional quote. About mannitol. Mannitol opens the floodgates, but unless you monitor wisely, it may drown the patient. Dr. James Koch, neurointensivist. This highlights the powerful effects of mannitol in inducing osmotic diuresis, opening the floodgates, of urine output. However, it also warns about the potential risks if mannitol isn't used carefully with proper monitoring. Without wise monitoring, mannitol's effects on fluid balance and electrolytes could lead to complications, drown the patient. Thank you for watching. If you liked this content, don't forget to like to show your support, comment and share your thoughts. Share with your friends and family. Subscribe for more exciting content. Your engagement means the world to us. Stay tuned for more.